So there's 3 stations that you want to be at. First one is flat. And over that 7 minutes, we have a timer right there. You'll start for 30 seconds here, flat. And then there'll be 30 seconds on the arch, okay? And then there'll be 30 seconds around the rotation. You can have them have their plastic bags on as well for cleanliness, right? Because we don't, you know, you're going to have multiple people coming through and you don't want toe cheese on that, right?
Yeah.
So you don't really have to go, to start off, you go very light. You want to be able to feel the knee vibrating, okay? This is too high. For people with sensitive feet, you might have a little pillow that you can put down, right? We don't want to put too much input into the sensory nervous system right away until they're healed. So the most that you'll ever do is maybe 3, okay? But you tell them, through that 7 minutes, you're just rotating. So go to the 2 other stations. So 30 seconds there. See how nice that feels? You get in that arch. Feel that? And then do the top one, third one. Get the balls right over here.
Oh.
Feel that, how nice?
Mm-hmm.
Okay? So they're just, it's a little dance they're doing for 7 minutes. Boom. Okay? Good. Now the other thing you can do, especially if they're sitting on that bench, this can be a calf one. So you, or this, look, boom. Now we bungeed it down, and you do have to have a little chair. Yep, that was on the video. See that? So then, boom. So there's 2 stations, and this just helps you buy time, right? So you got 7 minutes, 7 minutes. Patient has it at home. They should not do more than 15 minutes of body vibration. And you can't do it if you're pregnant. It feels good, right? So you're just moving around back and forth, boom, bang. Good.